Good morning, everyone. Thank you so much for joining us today for our presentation on stroke awareness and education. We have with us today 3 different team members from Emory Healthcare's different stroke centers at our hospitals. So we have Pat Victor, Genevieve Lyons Cobb, and Keisa Wilson to talk to us about stroke education and prevention in honor of Stroke Awareness Month in May. So we are super excited for them to be with us today and share some really great information with everyone. So I am going to share my screen to pull up their presentation, and we'll pass the baton off to them. All right. Team, the floor is yours.
All right, you guys. Good morning. I want to start by just introducing ourselves before we get into the presentation, just in case you guys may not be able to see us once we're starting and talking. My name is Keisa Wilson. I am the stroke coordinator for our Emory Decatur Hospital, as well as our Emory Hillendale Hospital. So we serve a lot of you guys in this community here. We are a community-based hospital, so we do see those that live around in the DeKalb area, as well as the Lithonia Stone Mountain area as well. Genevieve?
Well, hi, everyone. I'm Pat Victor, and I am the stroke coordinator at St. Joseph's Hospital in Sandy Springs. And we also serve a portion of the DeKalb County area, along with Fulton and Gwinnett and some Cobb County. I've been in this role for with Emory actually for 10 years, but with St. Joseph's for 7 years.
And I'm Genevieve. I'm the clinical quality coordinator for stroke at St. Joe's, aka Pat Victor's sidekick here at St. Joe's. So I'll be chiming in there.
All right, you guys. Well, first, thank you so much for having us, allowing us to be here to talk during Stroke Awareness Month. We're super excited about it. You know, that's our job, to be super excited. We hope that after this is done, you guys will be just a little excited as us, just to have some more information. So please feel free to stop us at any point during the presentation. If you have a question, you can raise your hand. There'll also be someone that'll be watching the chat as well, and we'll try to answer questions as we're done. We will be talking through different points, but we hope that once this is done, you guys will have some valuable information to take with you back into the community. Next slide, please. All right, so of course today we're talking about strokes and giving you guys some great information, but first we want to do some background. So about 795,000 Americans each year suffer a new or reoccurring stroke. And of course, having a stroke before could put you at a higher risk, but as you guys can see, that's a very large number. So there's a lot of ability for there to be some relational correlation to you, to someone you may know that have had a stroke, a family member, a friend, or yourself. Next slide. Now, when looking at stroke, it is also the number 5 cause of death in the US, and that's a pretty high number, you guys. That's something for us to look into and something for us to think about when we're talking more about this, but it is the number 5 cause of death in the US. Next slide. Now, stroke is a leading cause of serious long-term disability. And what this means is it can reduce the mobility in more than about half of the stroke survivors that are age 65 and older. These disabilities can range from different things, from being minor to being more severe, but it is a leading cause of long-term disability in our patients that we see. Next slide, please. Now, just some knowledge for you guys, about 37% of all Americans cannot accurately identify even one stroke warning sign. And that's definitely a sad number to report. We want to make sure that more people are aware of those signs and symptoms. And I'm going to tell you guys why that's really important. A lot for us here in this region that we are in. But keep that number in mind. Next slide. Now that number is important because we live in what we call the stroke belt. The stroke belt itself, as you guys can see on the map, is a region in the southeastern US, and this region has a higher than average stroke incidence and mortality. And of course, as you guys can see, this includes Georgia as well, but also I'm sure as you guys can obviously see that this includes what we consider the South, and a lot goes with that with diet and other things, which we're going to talk about. But we do live in the stroke belt, so that 37% number that we just saw before, that's an even more important and frightening number, just because we live in an area where the incidence is so much higher, but we don't have many people that can identify at least one symptom. So hopefully by the time this is done, you guys will be able to identify at least a few. Next slide. Being ready for a stroke can definitely save a life, and this could possibly be your life or the life of someone that is close to you or a loved one. Could even be a stranger that you may identify and see something for. Next slide. Now we're going to talk about a little bit of the perception of a stroke, or what we think a stroke is, what we've heard, what we've seen. We're going to talk about some myths, and then we're going to actually talk about the realities. So stroke, some myths, of course, would include that a stroke is not preventable, that strokes cannot be treated, and that they only happen in the elderly. And I think all of us can say that we definitely know that that's not true. I have patients as young as 18, because we see adults here, and as old as in their 90s that are coming in with strokes, or older. I have had a couple older patients. Stroke happens in the heart. And another myth includes that the stroke recovery ends after 6 months, and that's not true. Recovery for stroke, depending on the disabilities or the deficits that you see afterward, can actually include much longer, and it's still a lifelong journey of just knowing those risk factors, because you are at a higher incidence of having another stroke. Now, what's some of the realities? Up to 80% of strokes, they are preventable. Strokes require emergency treatment. And also, as we stated before, anyone can have a stroke. It does not, is not age dependent. Another reality would be that a stroke is a brain attack. This is something that is occurring in the brain, which we're going to talk more about. And that, again, the stroke recovery can continue throughout life, because you are always constantly looking at those risk factors, as we all should, knowing what those things are for you, specific for you, and how you can affect those personally yourself. Next slide. Okay, so we've been talking about some of the background, but what is a stroke? We've gotten there. A stroke is a brain injury that is caused when a blood vessel that leads to the brain becomes blocked or burst, which cuts off the blood flow and the oxygen to that part of the brain. So when these injuries happen or occur in the brain, the part of the brain that isn't able to get blood or oxygen that it needs would, of course, eventually start to die. Those brain cells would die. Next slide. Now we're going to talk about 3 different types of stroke, or the 3 different types of strokes in a broad general sense, and those things that occur for those to happen. We're going to talk about ischemic strokes. We're going to talk about transient ischemic strokes, which are TIAs, and you guys know as mini strokes. And we're going to talk about hemorrhagic strokes, or what you'll hear some refer to as a bleed. So first, when looking at an ischemic stroke, as you guys can see here in the blood vessel in the visual on the side, you can see that there's a canal or opening in the middle that allows blood, oxygen-rich blood, to flow through. So what happens during an ischemic stroke is those blood vessels become blocked or clogged, and this can either be with a fatty deposit, some fat that you have in your blood system, or from a blood clot itself that causes that blockage and blocks the blood and oxygen to the brain. Next slide. Now, when looking at our TIAs or our mini strokes, these are probably the most common that people will hear about or know anything about. TIAs are what we consider warnings that can happen before a major stroke. They occur when there's a very low blood supply to the brain, or it is briefly or temporarily blocked off. TIAs are temporary, but have the same signs and symptoms as you would see in an ischemic stroke or another stroke. And these are still considered medical emergencies. A lot of times patients may not come in because the symptoms can resolve so quickly, but those are still medical emergencies, and you should still seek medical attention for those. Next slide. And then lastly, I'm going to talk about our hemorrhagic strokes, which are considered the bleeds. And these bleeds happen with ruptured blood vessels in the brain. They are commonly caused by high blood pressure. Actually, that is the most common cause, which attributed to about 80% of those hemorrhagic bleeding strokes that we see. Aneurysms as well, which is a ballooning or a weakened spot of a blood vessel, which just allows it to protrude out from its normal space. Or conditions or diseases that cause blood vessels to be malformed or weakened or thickened, such as arteriovenous malformations, or also Moya-Moya disease, which is a chronic disease that causes narrowing or hardening of the blood vessels. But as you guys can see again with the visuals, with our hemorrhagic strokes, they're just the blood vessels rupture, which causes blood to leak out into that surrounding brain tissue. All right, next slide. Right, I'm gonna hand it over for some prevention and risk factors.
Okay, good morning, everyone. Well, the good news is that strokes are preventable. 80% of strokes can be prevented with healthy behavior modifications. Next slide, please. So we have things called risk factors. And what are risk factors for stroke? So risk factors are something that increases the chance of developing a disease. So risk factors for stroke would be something that increases the risk of developing a stroke. Next slide, please. And we like to divide risk factors into two buckets. Risk factors that we have no control over and risk factors that we can control. So those risk factors that we have no control over are age, and as we grow older, our risk for stroke increases. Gender, the lifetime risk of developing a stroke is higher in women. Race, Black and Latino communities have an increased risk of stroke. Family history, sometimes strokes are caused by genetic disorders and previous stroke or TIA. So unfortunately, about 25% of patients that have a stroke will develop a second stroke. Those are the risk factors that are not in our control. But here is the good news. These are the risk factors that are in our control. So we have high blood pressure, obesity, lack of exercise, sleep apnea, high cholesterol, cardiovascular disease, diabetes, smoking and drug use, and alcohol use. And we're going to talk about a few of these. Next slide, please. This is something that wasn't on those risk factors that we can control, but in a way we can control atrial fibrillation. Atrial fibrillation is a very common condition that causes an irregular heartbeat. So these two top chambers that you can see in this graphic beat irregularly, and this irregular heartbeat can also cause clots to form in those chambers of the heart, and they can break loose and travel to the brain and cause strokes. So atrial fibrillation is a condition that we can control with medication to control the heart rate, and we can also control with blood thinners that will prevent clots from forming in the heart. Next slide, please. And here we get to high blood pressure. So high blood pressure is the #1 risk factor for stroke. I can tell you that at St. Joseph's alone, 80% of our stroke patients have high blood pressure. And long-standing high blood pressure over time, if this blood pressure is not kept under control, it can cause plaque to build up on the inside of the vessels. And then when plaque builds up on the inside of vessels, it causes them to narrow and thicken. And that creates our increased risk for stroke. I don't know if you're aware of what the American Heart Association blood pressure goal is now, less than 130/80. Next slide, please. Diabetes is another very common risk factor for stroke. And diabetes is a chronic condition, and it causes high sugar in the blood. And this high circulating blood sugar, or we call it blood glucose, can cause plaque to build up on the inside of the arteries. And again, Once plaque starts to build up on the inside of arteries, it narrows them, it thickens them, and sometimes this plaque can crack. And when this plaque can crack, a clot can build where the crack is, and also this plaque can break loose and travel to the brain and cause a stroke that way. It's very, very important to keep blood pressure under control and keep blood sugar under control. Those are two very important risk factors for stroke. Next slide, please. And then here we get to high cholesterol. So cholesterol is a waxy substance that's in our blood, and we need some cholesterol. It's important for our cells to function. But when we have too much cholesterol in our blood, it can cause fatty deposits on the inside of the blood vessels. And then again, once you start to have the cholesterol build up and the plaque build up on the inside of the vessels, they narrow. And when a vessel narrows, that plaque can crack. And then again, like I mentioned earlier with diabetes, it can cause strokes. So our goal for our total cholesterol is less than 200. And we have good cholesterol and we also have bad cholesterol. And the good cholesterol is called the HDL. And I like to consider the HDL the healthy cholesterol. And those numbers should be higher than 50. The LDL is, I would want to consider that the lousy cholesterol, and those numbers should be less than 100. So those are your kind of like your goals. Blood pressure less than 130/80, blood glucose less than 100, blood cholesterol less than total cholesterol less than 200, the bad cholesterol less than 100, the good cholesterol greater than 50. Next slide, please. And this is a great slide because this kind of talks about those three risk factors that I have been emphasizing. So if somebody has blood pressure alone, high blood pressure alone, that creates a 1.5 times greater risk of stroke. If somebody has diabetes alone, no other risk factors, they have a 1.8 times greater risk of developing a stroke. If somebody has high cholesterol alone with no other risk factors, they have a 2.3 times greater risk of stroke. The more risk factors you have, the greater chance of developing a stroke. So here we are, if we have high blood pressure and diabetes, well, now we have a 2.8 times greater risk of stroke. If we have high blood pressure and high cholesterol, we have a 3.5 times greater risk of stroke. If we have high cholesterol and diabetes, we have a 4 times greater risk of stroke. Often we see our stroke patients have all three of these things. And when you have high blood pressure, high cholesterol, and diabetes, you have a 6.2 times greater risk of developing a stroke. Next slide, please. Okay, it is very plainly stated on this slide. If you smoke, stop. I'm going to say it again. If you smoke, stop. Smoking doubles our stroke risk. Smoking is something that creates a higher level of inflammation in our body. And when the level of inflammation is raised in our body, the blood vessels become diseased. And when the blood vessels become diseased, we have a higher incidence and a higher risk of strokes and heart attacks. Next slide, please. And then, of course, everything in moderation. None of us are ever going to say you can't have a drink, but in moderation. So, one drink, 1.5 ounces of liquor, 5 ounces of wine, or a beer each day is really what we recommend, no more than that. Next slide, please. And exercise is so very important. Lack of exercise could contribute to, a higher cholesterol levels, obesity, high blood pressure. So when we, engage in moderate exercise 5 times a week, and that could be like 30 minutes, 5 times a week, we start to see changes in our body. we start to see our blood pressure lower. We start to see our cholesterol come down. We start to see our blood sugar come down. And then all of a sudden, when these things start to become more normal, we have a lower risk of stroke and heart disease. So it's so important, and you feel better. I think emotionally you feel better. I think risk of depression is lessened. So it's very important to engage in some kind of moderate physical activity. Next slide, please. And then obesity. So being overweight certainly can increase the risk of stroke because, number one, too much body fat can contribute to high blood pressure, high cholesterol, diabetes, and then start to line the vessels with plaque and causing them to narrow, causing a setup for stroke and heart disease, kidney disease, and other diseases too. Next slide, please. Okay, I am going to pass this baton over to Genevieve.
Hello again. So thinking back to that, one of the first slides, that about 37% of us cannot identify a sign of stroke. So we've got about 30 people on our call. So maybe 10 or 11 of us don't know a sign of a stroke, and we're going to fix that right now. Next slide, please. This is the little mnemonic that we've been using to help us remember what those signs of a stroke are. So 5 of them are to help you remember a sign of a stroke. It's be fast. And for all of these, you're thinking about a sudden neurological change. So B stands for balance. So that's a sudden change of your balance or your coordination. E is for eyes, which means a sudden change in your vision, a sudden double vision or a sudden blank spot in one of your eyes. F is for face. So that's for asymmetry in your face. If one side of your face is weak or drooping from the other side. A is for arm or leg. I know A is not for leg, but for arm, just to remember that if you're having weakness on one side of your body, that's another classic sign of a stroke. And S is for speech. So that's a sudden change in the way that you are speaking. It could be slurred, it could be garbled, you could have a difficult time understanding someone's speech suddenly, or a difficult time finding the words that you're trying to say back. And then the T is just to remind us that then it's time to call 911. It's time to, this is an emergency. It's a brain attack, as we already said. And so it's time to get emergent medical attention for this. Next slide, please. This is going through each one of them in just more in depth. So the balance or coordination, you might see someone suddenly leaning to one side or feeling so dizzy that they like the room is spinning and they're nauseous and even like having to throw up. That's for the B, balance. Next slide, please. And then again, E, eyes. So these are some examples of some changes that stroke can cause. You see there can be double vision, like maybe the eyes are not tracking the same way, or there might be a field cut. You can't see part of the picture. It could also be blurred vision, but more so it's that would be a result of kind of a double vision causing the blurring. But any changes, sudden changes in your vision is a medical emergency. Next slide, please. And then here are some pictures and cartoons of asymmetrical faces. So F again is for face. So any changes in the face where you've got weakness on or numbness or tingling, especially on one side of the face. Next slide. And then here's A again for arm. Do you have weakness or numbness or tingling, any sudden neurological change in your arm or your leg? You can ask a person to raise up their arms and maybe they won't be able to raise up one of them, or maybe it will drift down. And that's it's a classic symptom of stroke. So A there is for arm. Next slide, please. And again, S for speech. So that could be sudden trouble understanding what someone is saying, or sudden trouble coming up with the words that you need to say back, or your speech is slurred or garbled, just kind of a word salad, not making sense. And again, this is something that would be sudden. You can ask a person to repeat a phrase, like say, "You can't teach an old dog new tricks," or something simple like that, and see how the words sound. Are they able to say the right words? Are the words slurred when they say them? It's a good quick test. And next slide. So then T, it's time to call 911. It's time to get emergent medical attention for this. And we talked a little bit about TIAs, the transient ischemic attacks, or sometimes people will call those a mini stroke. So if you have these symptoms, any of these symptoms, and then they go away, it's still a medical emergency. You still should get checked out because, excuse me, as we talked about, it can be a warning sign that a bigger stroke is on the way. So never ignore these sudden neurological symptoms. There are always reason to get checked out. It's better to overreact and not have needed the attention than to miss something that needed to be treated. Next slide. That's all we got. We can open it up for questions.
Thank you so much, everyone. That was really, really great, helpful information. I personally thought I knew some stuff about stroke, and I definitely did not know all that info. So just to remind everyone, we have the question and answer functionality open. You all can use the chat, and I will also go through and allow folks to mute and unmute themselves if they like. And it looks like we actually got one question in the chat already. Why is the southern region at such a higher risk?
And that is such a great question. I will let Pat and Keisa take that one. I've heard their speeches on this already.
Either one, or I can take it. Well, the South, of course, is a lot to do with diet. Some of the trends we see here in the South with some of our foods, some of the things that we use, such as the butter, some country towns, the lard. I am from those areas, so things like lard, a lot of it is just contributed to diet. Also, there's a lower incidence of, in these smaller impoverished areas or just smaller areas, they're not seeking out medical attention as early as some others would. So those are some of the reasons why we just have our increased risk factor, just a lot to do with diet, our mobility, if we're moving and exercising as we're supposed to, those things that we love about the South, our Southern hospitality and great food, are also the things that work against us in this incidence when it comes to stroke. Pat, did you have anything you want to add to that with the Southern region?
I do. And one thing that we're very lucky in the Atlanta area because we're surrounded by hospitals, and the hospitals that we're surrounded by are actually stroke centers. But when you go into the more rural areas of Georgia, some of these people have to travel more than an hour to get to a stroke center. There's less physicians in the more rural area, and so the access to healthcare is less in these more rural areas of Georgia.
Yeah, those things coupled together kind of create that dynamic that just makes our southern region at a higher risk. Let's see.
I was gonna say, so it looks like we have a few other questions coming in the chat. Let's see. Can we do any home remedy on the way to go to 911?
That's an excellent question. Please do not give yourself an aspirin. And instead of doing something, what I'd rather you is don't give yourself an aspirin, because remember, Keisa said there's two types of strokes. One is the clot and one is the bleeding kind. And if you give yourself, if you don't know which kind you're having, which we don't until we have our CAT scan, we could be giving ourselves an aspirin. And if we're having the bleeding kind of stroke, we could make our bleeding worse. So that is one thing. And then the other thing is, don't eat or drink anything, because if you're having a stroke, you may have trouble swallowing. And I don't want the food or fluids or medicine or something to go into your lungs rather than into your stomach. So the best thing you can do when you recognize these symptoms is to call 911.
Absolutely. I'll add to that just a little, Pat. I completely agree with what Pat said. The most important thing is that time aspect of Genevieve's Be Fast acronym. Just getting to help. That's the thing that you can do while waiting, just trying to get there as quickly as you can. Things are very time sensitive for us once you arrive in the hospital, and the more time we have, the more options we have available. So as she was saying, don't eat or drink anything. I know we want to do something, because we're, of course, anxious and in a state of panic that something may be wrong, but the best thing is just getting to some help. Let's see. I see another question. I was about to say, how soon do individuals start having symptoms before the actual onset of a stroke? I will say, if you're having any symptoms, then the process has already started. From my understanding, there isn't usually an aura or things happening. Symptoms that you may see, such as tingling or things that are resolving, as you guys remember, could be signs of a TIA or those transient ischemic attacks. So there isn't really an aura or anything like we see with migraine, seizures, those kind of things. I know that you're thinking, but if you're having symptoms, that process has already started.
Mhm.
Okay.
It's sudden. It's a sudden onset. There's no warning.
Mm-hmm.
It looks like there's another question as well. Somebody asked, should you routinely take an aspirin daily?
Only if your doctor tells you to.
Yes, and again, for those same reasons that Pat was saying, just because I know that before we've heard people tell us to take an aspirin, or that's a good thing to take an aspirin daily, but if you don't know what conditions you may already have, that aspirin, which is a blood thinning agent, could make those things worse. And again, as she was saying, you don't know what type of stroke that you may be having. If you're having a bleeding stroke, then taking an aspirin is the worst thing that you could do. Is the opposite of what we would want to do. So only if your doctor recommends taking an aspirin daily. Let's see. And then I see a great comment. It says, absolutely the diet. I'm from the Midwest, and there is a visible difference in our Southern family members as it pertains to body composition and obesity levels. Thank you for that. That's really great feedback. Thank you for that.
I see there was also a question in the chat that Genevieve, maybe you just want to read aloud as well, again, just for the differences between a TIA stroke and a mild stroke.
Yeah, sure. And that's a great question, because you often hear them used interchangeably. So TIA is the transient ischemic attack. And the way that I've heard this described that makes sense to me is that it's like there was a teeny tiny clot, like maybe the size of a piece of glitter, that went into a very small vessel, and it just blocked the blood for a second. And so you had these symptoms of a stroke, but then that little tiny clot just got pushed on down, or it dissolved, and it doesn't stay long enough to cause any lasting damage to the brain. So there won't be a stroke on your MRI because it was a transient event. A mild stroke or a small stroke, it would be just a stroke that caused damage in a very small part of your brain. So that would show up on an MRI. That's a great question.
What does, I guess if you all just want to briefly speak to in terms of what does treatment and recovery look like for folks who have experienced a stroke?
So that's a great question. Treatment can be very time sensitive. So the sooner you are to the start of a stroke, the more treatment options we have. That's like with anything. And we have a medication in all of our emergency rooms, and it's called TPA, and it's a clot buster, but it can only be given within 4.5 hours of the stroke actually starting. Okay, so you have to kind of know when you were last seen normal. And that has to be, so our treatment has to be within 4.5 hours of that time. And what this medicine does is it attaches itself onto the clot. And a clot is like made up of fibers, and it breaks apart these fibers. And once the fibers break apart, then the blood can flow through again to the brain. So that's a time sensitive treatment. And we only have 4.5 hours from the time the stroke starts to give you this medicine. And so we don't give it a whole lot because most people don't come to the hospital within 4.5 hours. But when you do, we may be able to give it. The other treatment that we have would be more supportive, in like we would make sure that you're put on the right medicine. We make sure your blood pressure is under control. We make sure that we put you on cholesterol medicine. We make sure that your blood sugars are under control. And we get all the specialists in the hospital that need to see you and evaluate you and make sure that we put you on something that's going to make you successful for when you leave. That's all part of treatment is making sure you don't come back.
Mm-hmm.
Keisa, do you have anything to add to that?
I think you explained that pretty well. I think that's a rabbit hole that we could go down. We could do a whole class just on treatments that we could give. Again, as she was saying, the most important part is time. We have those 4 hours after the start. It's really important. The first questions we'll ask you, one of the first when you come in is, when was the last time you were normal? And that kind of helps us base treatment and what we can do from there. And of course, other strokes such as the hemorrhagic strokes or the bleeds, there's different treatments treatment that we can do to help relieve some of that. But a lot of that is kind of waiting to see how that progresses and what happens. I know, Lindsay, you did mention about rehab and what life looks like after you've had a stroke, because we deal very, of course, acutely here in the hospital while you're here getting that initial treatment, just getting you back to what we consider your new normal, whatever that is. Some patients don't have large deficits, or they can return back to baseline. Some patients may experience mild symptoms to more severe deficits that they may see. We start in the hospital with doing some type of rehab evaluations, whether it's physical therapy, occupational therapy, and of course, speech therapy, to test to see if you're able to swallow safely, swallow medications, food, drinks, liquids, those things safely, as well as physical and occupational therapy to test your mobility, your functional strength, those things that you'll be able to do at home. And just taking care of yourself. So they do those evaluations to determine what type of treatment you may need moving outside. Of course, some patients may not need any treatment following the hospital. Some patients may need continuing treatment at home, such as health, or more acute in inpatient rehab therapy, where they continue to work with you on those deficits. And again, building that normal, or what normal is now moving forward for you. So that's a little bit. And again, recovery is individualized. It depends on the person, what happened, what type of stroke they happened, and what deficits they had following or afterwards.
And tacking onto that, we were talking about how important it is to get help as soon as possible, and when your stroke is starting, like as soon as you see those symptoms, your stroke is starting. About 2 million brain cells die every minute that your stroke is happening. So the faster that you can get to help, the more likely it is that brain cells will be salvaged. And the faster you can get blood back into the brain, the quicker it can recover itself.
I know we just had another kind of question comment in the chat as well in regards to family history, and if individuals in your family have previously had strokes, does that increase your risk? And it looks like Genevieve, you had said yes, that family history is a stroke risk factor, and something to discuss with individuals' primary care providers to ensure they're managing that correctly.
And again, even though you can't control whether or not you have a family history of stroke, of course, but like Pat showed, there are so many risk factors that you can control, and so many more are the ones that we can control than the ones that we can't. So it's important that it's even more important then to look at all the ones that you can control and make sure that you're doing everything you can for all of those.
And it looks like we've had a few other questions coming in the question and answer function as well. I don't know if you'll want to speak to, Genevieve, it looks like you answered the one in regards to how do birth control pills potentially raise a woman's chance of having a stroke?
So hormones make us more likely to make clots, and Pat and Keisa, feel free to jump in on this anytime. So you might also hear that birth control pills can increase your risk for deep vein thrombosis or DVT in your legs. You might have heard about that as well. And so they just make it more easy for our bodies to make clots, and that's clots anywhere, brain, leg, wherever. So it's that hormone component that makes us hypercoagulable or more able to make a clot. There's another question in here about how would somebody know if they have a PFO, which is that patent foramen ovale, that little hole in between the atrium of the heart. And you would know if you had an echocardiogram. So that would be something that a cardiologist or your primary care provider would refer you for.
That was a great question.
Mm-hmm.
Let's see, I think we got all of the questions that have been coming in. I know we have a few more minutes left, so if anybody else wants to add any other questions, comments, you all are also able to unmute yourselves if you'd like. I'm just going to check the chat one more time here. All right. Well, we'll still be on here for a few more minutes. If nobody else has any other questions, just wanted to say thank you all so much to our presenters this morning, Genevieve, Keisa, and Pat. This is really valuable, incredibly helpful, and important information. Oh, but it looks like we did have another question just come in. Somebody asked, can a person fully recover from multiple strokes?
I think it,
What are your thoughts?
I was going to say, I think it just depends on how big the strokes are, how old the person is, what their medical condition is at the time that they have the stroke, and where the strokes are. And you know, and how severe they are. That all of those things come into play.
Yeah, because you can have multiple strokes and the severity level be different in the different strokes that you have. So in theory, yes, someone could have multiple strokes and completely recover, but there's so many different factors that play a part in that would contribute to how that result would be. So.
Mm-hmm. And there's a question here that says, if someone has had a TIA, could processing thoughts be affected? So remember, a TIA is there's no permanent cell damage in the brain. So on a long-term basis, it wouldn't cause problems with processing thoughts. You could have problems with processing thoughts while you're having the TIA, but not if you have had a TIA in the past, because it shouldn't cause any damage to any of the cells in the brain.
I also just want to say thank you to all of our participants this morning as well. You all have had some really great questions to make this a really helpful, informative conversation for everyone. So appreciate everyone's participation this morning. All right, well, with that, I'm going to stop our recording, and then I have one other thing I wanted to share with everyone today, but let me stop our recording first.